So next up, Hayley Gleason. Thanks.
All right, good morning, everyone. My name is Hayley Gleason. I'm the Older Adult Policy Advisor with the Department of Healthcare Policy and Financing, which we call HCPF. But HCPF is our state Medicaid agency, just to ground everyone, make sure everyone knows who we are. I think Kathy and Susan did a fantastic job of really setting the stage from a national perspective of really what's happening in aging, what are the challenges as well as the opportunities as we're looking to ensure that we can serve our older adult residents and population now and into the future. So what I'm going to do is transition and talk a little bit about what we're doing here in Colorado, particularly at Medicaid. So to begin, I have to start with our mission. HCPF's mission is improving healthcare access and outcomes for the people we serve while demonstrating sound stewardship of financial resources. So I want to begin by just sort of giving some context about who I'm talking about in my presentation. And this slide should not shock anyone in the room. But I wanted to bring it up for a couple of reasons. I think first, it helps us to think about what we're talking about at Medicaid. So obviously we know that we have huge growth in our older adult population, and that is only going to continue into the future and really is not going to slow down, right? This is not something that we're going to see a huge expansion of the older population and then it will drop sometime in the future. This is our new normal. And so for us at the department, we're thinking about this in a couple different ways. First, I think what's important to note is our oldest old population. I'm sorry, it looks like the 85 plus got cut off there, but it's 282% growth here in Colorado between 2015 and 2050. And for us, that's important to be thinking about. So when we're thinking about our oldest old here in the state, we know that older Coloradans often have more chronic conditions, greater frailty, more reliance on our healthcare system, and greater need for long-term services and supports. And often, as they're getting older, they're also outliving their resources, which means they may be more dependent or more likely to be dependent on Medicaid services. And so this growth for us is really critical because it means that there's going to be a greater demand for our services into the future. And we need to be thinking about and planning for how are we going to serve those individuals that really are most complex. So this is important in a number of ways. The other thing that I want to point out is that Colorado currently is the third fastest aging state in the country. We're soon to be second. We're going to pass Nevada. So the second fastest aging state in the country. And the reason for that is that historically we've been a demographically young state. And so aging is pretty new for us. So when we're looking at our Medicaid population, we have been relatively young. And so serving older adults and serving older adults in these numbers is, again, new and something that we are working to figure out as we go and learning from our partners. So it's not to say we've never served older adults. They've been in our mix for a long time, but we're going to have many more. And when we're looking at the proportion of our population within Medicaid, it's just going to be growing just like this. So that's really important for us. So who are our older adult members at Medicaid? So this splits between those that we serve through our long-term services and supports, and then those who are sort of our non-LTSS members. So they are Medicaid members, they are dual eligibles, but they're not currently receiving LTSS services. And you can see that that's a bigger population, about 45,000 people that are non-LTSS, and about 26,000 that are receiving some form of LTSS services. But When we look at our expenditures, you can see it flips. So about 92% of our expenditures are spent on long-term services and supports for older adults. And the reason for this is because of our dual eligibles, our Medicaid versus Medicare. So most of these individuals receive their clinical medical services through Medicare. It's paid for by Medicare. It doesn't get paid for by us. We pay about 8%. So we'll cover deductibles and some of those extra costs, but the vast majority is paid for by Medicare. Where most of our spending goes is to support them either in the community or in facility-based settings for their long-term care needs. So again, in thinking, in giving you sort of a glimpse into how we at Medicaid are thinking and planning for our older adult population, this is really critical because obviously we serve most of our older population in LTSS, and so that's where we can make the biggest impact. Unfortunately, it's pretty difficult for us to, when we're thinking about our levers and where we can make change, on the clinical side, there's not as much that we can do. So in terms of the breakdown of where or how we serve our older adult Medicaid members in LTSS, so these are those that are receiving long-term services and supports. I'm going to start with our home and community-based services. So these are programs like transportation services, day programs, assisted living, or services that come into the home to provide care for individuals. About overall, in all of our programs for all ages, we serve about 47,000 people, 40% of which are older adults. And you can see our spending, about 27% of our spending goes towards older adults. Those proportions don't add up quite right, so that's an area that we are also looking at. This is something that's important to us. Colorado has been really successful in moving more of our expenditures and our population to receiving services in the community. It's been a big push, and so we're really proud of that, but most of that movement has happened in our younger disabled population. It has happened with older adults as well, but it's been a bit slower. And so that is something that we continue to focus on and will be focusing on into the future. The next area, this data was included in the last slide, but I pull it out because oftentimes people are really curious about assisted living facilities. So that is considered a home and community-based service for us. And so they're called alternative care facilities when they're paid for by Medicaid. We have about 4,450 people enrolled in ACFs, and about 56% are older adults. PACE, which we've heard about a couple times so far. So the program of all-inclusive care for the elderly. We have about 3,000 people enrolled in this program here in Colorado, and 83% are older adults. So the vast majority are older adults. Given the age restrictions, that makes a lot of sense. Our PACE program is really robust and has been growing substantially in the past couple of years, so we're really proud of this program. And then nursing facilities. So I think a lot of people think of nursing facilities when they think of Medicaid long-term services and supports. And we have almost 16,000 people that are enrolled in nursing facilities here in Colorado that are paid for by Medicaid, and 76% are older adults. And so many of our older adults eventually will reside in a nursing facility. When we look at our age breakdown for nursing facility residents, are 85 and older. It's about half of our LTSS Medicaid members are residing in a nursing facility. And that is another area of opportunity. And when we're thinking about how can we better serve individuals in the community, this is one area that we're looking at of saying how can we ensure that people can remain in the community as they age, even in their later years. So how can we keep them there at home if that's possible for them? So this breaks down our expenditures. So again, for our older adult population, we still are just over 50% of our money that is going to skilled nursing facilities. And this is, again, an area that we're really trying to focus on because we want to shift this so that we can be keeping more of our older residents in the community and providing services, at home where they'd like to be. Second to that is our home and community-based waivers, and then our PACE program. And another reason why we're looking at that is because our skilled nursing facilities are our most expensive service. So not only do people want to remain in the community at home, but we also, it's a lower cost to keep them at home. And so there's dual drivers there in terms of how we can better support people as they age. So this is average total cost for older adults per setting by year. It's about $46,000 in a skilled nursing facility, $36,000 in PACE, and goes way down to $19,000 for home and community-based services. All right, so that was just a very quick overview of who we serve in terms of older adults within our Medicaid program here in Colorado. Again, very much focused on our long-term services and supports because that's primarily how we serve older adults. Now I want to talk and shift a little bit to talking about how we are thinking about and changing our programs to better serve older adults and some of our activities to do that. So this is an overview, and then I'll go into each one specifically. So our first goal around this effort is to align the work focused on older adults within the department. The second is to strengthen aging expertise within the department. Third is expanding our older adult stakeholder outreach and engagement. Fourth is enhancing collaboration with other departments and state level organizations. And fifth is launching a formal strategic planning process. So I'll go back to that first one, so supporting our ongoing work. So the department, in an effort, and this was sort of happening across the country, to break down silos, merged many of our programs and really worked to align waivers non-dependent of the population. So really wanted to show that no matter the waiver, no matter the population, you're receiving the same services and the same benefits. And I think there were a lot of pros and positive aspects of that effort. One of the challenges that came out of that is that we sort of lost some of that unique expertise for those individual populations. So, when you put everyone together, we often then forget about the uniqueness of different groups. And so that was one thing that was starting to happen at the department was that, when you group everyone together, maybe the needs and challenges and opportunities for older adults weren't being heard quite as much as some of the other groups in the room. And it sort of depended on who was the loudest voice. And sometimes our older adults or our older adult advocates were not the loudest voice. And so they sort of got lost in that shuffle. And so one area is to really try to refocus and be more intentional about what we're doing to serve older adults. So what are we doing in terms of right now, and then what are we doing for planning for the future, and really looking at our benefits and services from the lens of the needs of older adults. So that's been a really important shift for us. One way that they did that is create my position. So having someone at the department who specifically, my whole job is to just be the voice for older adults within when policy decisions are made, anything that may have a direct impact or a larger impact on that population. They want to make sure that they've got someone there, speaking for and on behalf of older adults. We've also been contracting and bringing in more outside vendors who can support our work through research, bringing in people who really can enhance what we're doing and have that expertise to inform the work that we're doing. So these are a couple of strategies that we either are working on or plan to work on in the future. First is to form an intra-agency aging strategy work group. So we have a work group within the department that meets on a regular basis that's talking about all of the different policies and decisions that are being made that may impact older adults. We're trying to better identify internal initiatives focused on the older adult population. So at Medicaid, if you've ever heard our executive director, Kim, speak, we have a lot of initiatives happening. And so we want to be sure that we're identifying those that really, again, would impact, have a greater impact on older adults and highlighting those. And then aligning our efforts and building collaboration internally. I got the 5-minute warning, so I'm going to speed up. Enhancing stakeholder engagement. So again, this is talking about and thinking about who are the loudest voices. Sometimes we didn't have a lot of older adults or older adult advocates that were coming to meetings and ensuring that we heard what their perspective and their needs were. And so we're really been trying to amp that up, and we'll continue to do that. Enhancing collaboration across departments, so trying to identify within each of the departments who are those aging experts and working more collaboratively with them. Finding areas where we're working on some of the same things and how can we better work together. And then participating in a lot of the other state level aging efforts that are happening. So being sure that Medicaid's at the table when we're having discussions about the future of Colorado as we're thinking about this population. And then our biggest effort at this point is launching our formal strategic planning process. So back in January, we launched this process. We've spent the year hearing from stakeholders, just getting out in the community. We've hosted a number of public listening sessions. We had one here in Boulder, just to find out what does the community think we at Medicaid should be doing to better support older adults. We worked with an external vendor to help us identify evidence-based practices and models from other states for what is happening in other states that we could learn from. And we had an expert advisory committee to help us put that together. This plan is set to be released in early 2020, so I can't tell you exactly what's in it yet, but I can tell you some of our promising strategies. So as both of our previous speakers talked about, social determinants of health is a huge one. And though Medicaid already is able to fund some areas of social determinants of health, this is something we really want to expand and make greater investment in. We understand that these, if we invest in nutrition, housing, transportation, that will lead to greater health outcomes. And so that's a big push for us. The other area is family caregivers. They are the backbone of our caregiving system. We know that we have a direct care workforce shortage, and that's only going to get worse, and that we are going to rely more heavily on our family caregivers. And so figuring out how we at Medicaid can better support family caregivers. Ensuring access to the right services at the right time. And this really focuses on our provider capacity. So if we don't have enough providers, and if we don't have providers that are high quality and have the training and qualifications needed to meet the needs of older adults, then we can't succeed, right? We need those providers to be prepared in the community. And so enhancing provider capacity is a big focus for us. And then last, investing in better end-of-life planning. And I'm just gonna highlight a couple of these. Again, I can't go into a lot of detail about our plan yet, but so in terms of family caregivers, this isn't specific to HCPF, but I think it shows how investment in family caregivers at the state level is, it really is a focus from the governor to us at Medicaid. And so in Governor Polis's budget, which he released last week, he announced that he was supporting paid family leave for state employees. And obviously at 8 months pregnant, I very much support that. But I also, I think it's important that it's not just for new parents, it's also for aging partners, for aging parents or spouses. This is an area that we need to invest in across the state to better support our caregivers, no matter the age. And I think this is really goes to the sort of age-friendly model of something that supports older adults doesn't have to not support younger people, right? So we can have policies and programs that are good for everyone, and this is an example of one of those. And then in terms of our own informal caregiver supports at HICPUF, this is a relatively new area for us. We have respite services, but we're re-looking at our respite benefits to see how do they align across our waivers, and then also how can we ensure that they are being used, that they're practical. Sometimes we say we have benefits and they're available, but they really don't make sense for families once they are tried to put into practice. And so this is an area that we're really looking at to say, what do we need to do to ensure that our respite benefits make sense for families and are really accessible and useful for them? And then, all right. I'll wrap up. Ensuring access to high quality services, and this really is around that provider capacity piece. So we have a couple of areas that we're looking at. Nursing facility program capacity is a big piece. So although we are very much committed to keeping people in the community and want to continue to expand our community-based programs, we realize that there will always be individuals that need nursing facility level of care. There will always be a demand for nursing facilities, and that's the reality. And we want to be sure that our nursing facilities that are available for those people, well, one, beds are available, and two, that it's high quality services that are available. So we're really trying to modernize our policies around nursing facilities, and so we're looking at our rate methodology, focusing on value-based payment, looking at expanding beds to make sure that we can meet the demand looking into the future. So that's a real area of focus. Our PACE program, again, I said we have had a lot of growth in our PACE program, and we want to make sure that is smart growth. And so we are looking at increasing our oversight of PACE programs. We are looking at performance-based measures for PACE. So again, thinking about quality, ensuring that all of our PACE participants are receiving high quality, consistent care, so that's a real push. And we're rolling out a satisfaction survey for our PACE providers. And then the last one is our direct care workforce. Has come up in every presentation thus far. It's a really critical issue, one that's really close to my heart. And I'm excited that we've been doing a lot here in Colorado and are launching a brand new effort around direct care workers. So we've had the last couple of years 2 wage pass-throughs, meaning we've increased our rate for home care providers, and in doing so have required that money goes directly to the workers in order to raise their wages and compensation. And so that's a really important area to make sure that we're increasing their compensation and really trying to stabilize the workers. But we feel that wages is only one area of focus. And so we're launching another larger effort. At this point, we have a cross-agency work group, so representatives from many of the state agencies sitting at the table trying to say, what do we need to do to support these workers? And that's everything from career advancement to enhanced training opportunities across the board, looking at benefits and services for them. And so that's a brand new initiative that we're excited to be rolling out. All right, and thank you very much, and if you have questions, I'm happy to answer them.